Hello, my dear future nursing officers. I welcome you all once again back to the Master Nursing classes. Dear students, in this very important session, we are going to deal and discuss those very important questions, especially the concept behind the questions. And by holding the one particular question, we are going to discuss around the 10 to 15 golden point on that particular concept. If any kind of the questions and concept which striking in your upcoming Norcet exam or any other state and central government exams like RRB, so these classes are going to definitely help you. And these golden point revision concept what we are discussing in the class. So here you will get the very important and high yield MCQs and their in detail answers plus the very important charts tables for your rapid revision purpose. So this is completely packed class where you will get a 360-degree approach content which is necessary for your exam. So I want every one of you to stay connected till end of the video and watch the video completely. If you have any doubts, so feel free to mention the doubts in the live box or in the comment box. So that will be helpful for us to understand and reply to that one. Okay. And once again, I am welcoming you all once again back to the Master Nursing classes. ಭಾಳ ದಿನ ಆದ್ಮೇಲೆ ಎಲ್ಲರೂ ಭೇಟಿ ಆಗ್ತಿದ್ವಿ. So hope everyone is preparing well and busy in your revisions. Okay. So whatever the theory notes you have done, so please do focus completely and put your 100% energy on that one. Revise that. Read it, repeat it, revise it. So that is the only key to success. Okay, so keep on preparing and keep on revising. So definitely it will help in your exams and you will get the extra boosters like this. Also take use of this one. This is going to definitely help in your exam. Okay, so I hope everything is fine and we will start the class now without wasting a single minute of the time. Okay, so the first question of the class is like this. You can see here. There is a 65-year-old woman is there. Okay, so there is a 65-year-old woman is there. She falls on her outstretched hand. So how the woman is falling here? So she is falling on her outstretched hand. So when the people or when the patient will fall here, so he is falling like with the outstretched hand, means he is falling and he is keeping his hand by outstretched on the ground. Okay, so and she is now presents with a wrist pain and the deformity. So now she is presenting with a wrist pain and deformity, and X-ray is showing that there is a distal radius fracture is there. Means we have the two very important words here. So that is one is distal, another one is proximal. So consider this is the radial bone. All right. So this is the distal part of the radial bone, and this is which is near to my body, that is the proximal part of the radial bone. Here which part of the radius is got fractured? So here the distal part of the radius is got fractured. Okay, so along with that one there is in the dorsal displacement is there. Okay, so the fractured part is displaced dorsally. Okay, so what is the most likely diagnosis of this case? What happened here? So there is the 65-year-old woman is there. She fell down with the outstretched hand. Okay, and she presenting with the wrist pain and the deformity, and X-ray is showing that there is in the distal radius fracture is there. So dorsal displacement of the fractured part is there, especially distal part. What is the most likely diagnosis of this one? So option A is the Smith fracture, option B is the Colles fracture, option C is the scaphoid fracture, option D is the Barton fracture. So what may be the answer? Dear students, whenever we will talk about the distal radius fracture, we have the two very important options to choose and make it very clear concept. So that is one is the Smith fracture, another one is the Colles fracture. So this Smith and Colles fracture, so these are the fracture of the distal radius. So you can see in this particular image here, when a person fall with the outstretched hand like this, you can see the person is fell down here with the hand which is outstretched. So that time the distal end of the radius got fractured here. Okay, and this is the distal fragment of the bone which is displaced towards our dorsum. Okay, so outstretched hand is there where the radius is got fractured, that is at the distal area, and the distal portion of the fractured bone is moving towards the dorsum of our hand. So this is called as the Cooley's fracture. This is called as the Cooley's fracture. Sir, how to remember? Remember with the outstretched hand. Okay, so you can remember with here I will show in the question only. So here we have the outstretched hand. Remember with this O. Here the Cooley's fracture, that is the O. Okay, so outstretched hand means that is you have to choose the answer as the Cooley's fracture. And if the patient is fell down with the in-stretched hand, so like this, okay, wrist is inward turn, okay, so in-stretched hand, so like this the patient is fell down, so that time you have to choose the answer as the Smith fracture. So that is the Smith fracture. So in the Smith fracture you can see we have I here, okay, so that is the I means that is inward turn. Okay, so in the question mentioned question there is the outstretched hand is there. So she fell down with the outstretched hand means there is in the her distal radius is fractured means which part of like which fracture we call that one. In the outstretched hand the distal radius is fractured means that is the Cooley's fracture. In stretched hand the distal radius is fractured means that is the Smith fracture. So as per our question answer goes to the option B. So that is the Cooley's fracture as a correct answer. So you have to remember this one. Very importantly, this particular table you must and should remember. Okay, so this is important for your exams. Okay, so let me clear this table first for every one of you. Okay, so the mechanism of the fracture which is happening here in the Cooley's fracture, beta there is in the fall is there on the outstretched hand. I told outstretched O, Cooley's O, remember. Okay, so and in the Smith fracture fall on the flexed wrist or the in-stretched hand. Okay, so in-stretched hand or the flexed wrist fall is there, that is in the Smith fracture. Okay, and the distal fragment means the broken portion of the our bone. So that is the this is the broken bone, right? So this is become a two fragment. Now previously this was the one bone. Now it is broken means this is one fragment, this is another fragment. Similarly, here the broken bone, this is the distal fragment and this is the proximal fragment. So this distal fragment is moving towards the dorsum, that is in the Cooley's fracture. And this distal fragment which is moving towards the our like ventral portion or the anterior portion, so that is the Smith fracture. Are you getting the point, beta? Yes, sir. So these are the key words where you have to choose for the correct answer. Okay, so distal fragment displacement is there, right? So that is the dorsal or the posterior side distal fragment is moving, that is the Cooley's fracture, and the distal fragment displacement which is going anteriorly towards the palm, that is the Smith fracture. So that is going towards the olar area or the anterior area or the palmar area, we can say, right, beta? Yes, sir. Next is the deformity associated with the Cooley's fracture, that is the dinner park deformity. So when we will see the Cooley's fracture patients, so you can see the like the hand will be moved like this. Okay, so because of the damaged area. So here you can see it is associated with the Cooley's fracture is associated with the like it looks like a fork we will use to have the dinner with this particular fork. No, so this it will looks like, so that is the dinner fork deformity you can remember. And you can remember that in the Smith fracture there is the garden spread deformity. Okay, so you know this one will be used by the like gardeners to spread the garden. Okay, so this particular garden spread material is there. So like this our hand is looking means this one will be seen in the our Smith fracture. The deformity associated with the Smith fracture is that is garden spread deformity, and deformity associated with the Cooley's fracture is so that is our dinner fork deformity. Must points to remember, very important points to remember. Okay, so I told deformity associated with the Cooley's fracture is the dinner fork deformity, and deformity associated with a Smith fracture is the garden spread deformity. And wrist position at the injury, I told wrist position how I told means when the outstretched, that is the extension of the wrist is there. So the wrist position at the injury is the extension at the Cooley's, and like flexed wrist or the in-turned wrist means that is the wrist position at the injury is the flexion. So this is the very important table which is describing the difference between the Cooley's fracture and Smith fracture. So please do remember the distal radius fracture. So the both the Smith and Cooley's both are important. Okay, so the examiner can ask the question like anything. I hope it is very much clear. Next we have is the next question. So I hope the screen and question everything is clearly visible, and I want every one of you to read the question and put your answer. Yes, the question is simple and very simple. There is a 30-year-old man is there who is present after the road traffic accident. So on the examination, means whenever we are seeing the patient, we are examining the patient, there is the deep wound is there over the tibia. Okay, and bone fragments are visible through the skin. So what type of the fracture is this? So this is the question on the types of the fracture, and this is the one of the very important questions. So this is the 3-star question. Please remember this one. There is the 30-year-old man is there who is presenting after the road traffic accident history is there. On the examination, there is in the deep wound over the tibia. Okay, so in the tibia there is a deep wound is there, and the bone fragments are visible through the skin. Right? What type of the fracture is this? Very nice of you all. Okay, so the all of you have given the correct answer. That is the open fracture or the compound fracture. Better we have the two types of the very important fracture to understand here. You can see this image here. Okay, so when the what is the fracture? First you tell me what is the fracture. So this is the one bone we have. So that is the integrated bone. So this is what we can say integrated bone. When there is the loss of integrity, or when there is the break in the continuity, okay, so this is the continuous part. When this is broken, so this is called as the break in the continuity of the bone, or a break in the integrity of the bone. We call that one as the fracture. Okay, so here the bone is got breaked in its continuity, and the end of the bone is came out of the skin. So that is skin is broken, and through the skin the bone is come out. So that is called as the open fracture. And the bone is broken and it is inside the skin only, it is not came out, that is the closed fracture. Very important 2 points. Okay, so this particular closed fracture, it means the bone is broken, you can see here, and it is not pierced out of the skin, it is still inside the skin only, that is the closed fracture. And for this closed fracture only we also call as the simple fracture. Okay, so we call this one as the simple fracture. Okay, and for this open fracture we call this one as the compound fracture. We call this one as the compound fracture, where you can see the bone is pierced out of the our skin, so the bone is visible through the deep wound. I hope it is very much clear to every one of you, right? Yes, beta. So that is the compound fracture, or the open fracture is the correct answer, because in the question there is a deep wound, and in the wound bone fragments are visible through the skin. So what type of the fracture is this one? So that is the option D goes to the correct answer. And I shown the image of the closed fracture also. This is not closed fracture. And we have the green stick fracture and box fracture in the children. We will discuss this fracture separately because that is very important. And I will take you to a beautiful ride on the different types of the fracture images here. Okay, we can see here. So if the bone is broken like this, so this is the transverse fracture. There is a transverse break in the continuity, and bone is broken just like a line. This is the linear fracture. This is the linear fracture, and bone is broken in an oblique way. So that is the oblique fracture. Okay, and oblique non-displaced, because the bone is broken, but it is still in its place only. Okay, it's not displaced. And similarly, the bone is broken and it is displaced, means we can say this is the oblique displaced fracture. And there is another twist in the bone is there, so that is called as the spiral fracture. One side of the bone is broken and another side of the bone is just bended. This is called as the green stick fracture, which is most commonly seen in the children's. And if the bone are broken and the parts are, you can see there are the more than 3 fragments are there, so this is called as the comminuted fracture. Okay, so this is called as the comminuted fracture. These are the some images you may expect in your exam. Okay, one side broken, one side bend, that is the green stick fracture. More than 3 fragments are there in the fractured bone, that is the comminuted fracture. There is a twist and break in the bone, that is the spiral fracture. And there is in the oblique cut and which is separated, that is the oblique displaced fracture. oblique cut and not separated, that is the oblique non-displaced fracture. Just there is on the line is that there is the linear fracture, and there is on the transverse cut is there, that is the transverse fracture. And the bone is broken and came out, that is the compound fracture or the open fracture. Bone is broken and still inside the body only, and the skin is intact, that is a simple fracture. So these are the various type of the fracture. Now I will show you some very important types of the fracture overall as the rapid revision points, and I am telling the some very important clues and very important golden points, the words which will help you to choose the correct answer. Okay, so that one you must and should you have to keep in your mind. Okay, closed fracture we also called as the simple fracture. In this one, bone is broken but not came out of the skin, so the skin is intact here. The skin is intact here, the word which is very helpful for the choosing the correct answer. Okay, and we have the compound fracture, open fracture. The skin is broken, skin is breached, and the bone pierced the skin and came out. The highest risk of the osteomyelitis in which fracture? So highest risk of the osteomyelitis in the open fracture, because which is exposed to the inner body organ, that is the bone is exposed to the external environment. The highest risk of the osteomyelitis or the highest risk of the bone infection is there in the opened fracture. Next we have the complicated fracture, that is the fractured part which is compressed the some vessels and some very important nerves. That is what you call as the complicated fracture. And we have the complete fracture and incomplete fracture. So what is the difference between the complete and incomplete fracture? So we can see this is the bone you consider. Okay, so this is the one bone you consider. There is the break in the bone is there, but not completely. Okay, this is the intact bone. You can see this is the intact, and there is break in the bone is there, but it is not completely separated, half only fracture. So this is called as the incomplete fracture. Okay, so entire length of the bone is broken and it is separated, that is what you call as the complete fracture. Okay, so complete fracture in the sense entire width of the bone is broken, and the incomplete fracture means partial break is there. So that is common in the children's. Okay, very important. So I want to say with the image means you can see here. So this is the entire length of the bone. Okay, so here what happened, only this much is broken. Okay, so one side is intact. This is the incomplete fracture. If the bone is completely broken, so it become a two part. This is the complete fracture. Are you getting the point, beta? Yes, sir. So I hope it is very much clear to everyone, right? Yes. And the next very important point is that is the transverse fracture. I told that is the slight horizontal line is there. Okay, so horizontal line is there, that is the transverse fracture, and the oblique is diagonal line is there, that is the oblique fracture, and the spiral is twisting injury is there, that is the spiral fracture, and comminuted is the more than 3 fragments are there, that is the comminuted fracture. I told the bone is there like this. Okay, so if there is in the transverse means there is a straight horizontal line cut is there in the bone, that is the transverse fracture. There is the oblique cut is there in the, or the diagonal cut is there in the bone, that is the oblique fracture. And there is a twist is there, that is the spiral fracture, and more than 3 fragments are there in the bone, that is the what we can say as the comminuted fracture. Next one is segmental fracture. One bone is broken into the 2 separate area. Here also it is broken, here also it is broken. So this is called as a segment. Okay, this is one separate segment, this is a one separate segment. That is the segmental fracture. There is a 2 separate fractures are there. 2 separate fracture lines are there. So that is the segmental fracture. And impacted fracture. So what is the impacted fracture? So this is one bone. Okay, sorry, this is the one part of the bone. This is another part of the bone. It is broken, but it is impacted on each other. Means a distal part of the bone is moved inside the proximal part of the bone like this. So there is a telescoping is there after the fracture. So this is called as the impact. Okay, one fragment is driven into the another fragment. Okay, so like due to the compression, this kind of the impacted fractures will happen. Okay, so this is the bone broken, and one part of the broken part is going inside the another part. So this is the impacted what you can say fracture, or the telescoping of the one end of the broken bone into the another end of the broken bone, that is the impacted fracture. So this is happens due to the compression. Okay, so I hope it is clear, right? So impacted means one fragment of the bone is driven into the other fragment of the bone. So that's the impacted fracture. Next we have the compression fracture. So that is the like we have the vertebral collapse. Okay, so where there is an intervertebral disc will be compressed and the two vertebrae will become in a direct contact due to the compression. Okay, so next we have the depressed fracture. Okay, so the depressed fracture means the bone will be moved inward. Okay, so like especially skull bone. Okay, so when there is in the hard hit, the bone is moving inside. That is what you call the a bone pushed inward or the depressed fracture. Okay, so next we have the avulsion. Okay, so avulsion means the bone is damaged. Okay, consider this particular bone is damaged and separate, but still it is in a contact with the body because it is attached to the our tendon or ligament. Okay, that is what we call the avulsion fracture. The fragment of the fractured fragment still in a contact with the body because of the attachment with the tendon and ligament. That is called as the avulsion fracture. Okay, so avulsion fracture means tendon and ligaments pulls the fragment of the fractured bone. That is the avulsion fracture. Stress fracture means due to the overuse. Okay, repetitive overuse of the one particular body part, that will cause the stress fracture. Next we have the pathological fracture, means due to the diseased condition, like the patient may having the osteoporosis, where there is the completely loss of the mineral density of the bone, where the calcium is lost, phosphorus is lost, and the bone is more fragile to get fracture. So that is the osteoporosis, where the bone is like a very soft, okay, which is like a chips, where you will break it, you will break. Okay, that is what you call the fragile bone. Okay, so due to the disease conditions like rickets, osteomalacia, osteoporosis, and other conditions, other causes, like we can consider as the multiple myeloma, as a plasma cell tumor which is directly impacting over the bone and bone marrow, which is making the bone to get like demineralized and destroyed. Okay, and other conditions like you consider the hyperparathyroidism, where the parathyroid hormone is excessive and which is taking the calcium from the bone out. Okay, so that may causes the fracture of the bone. Okay, so these are the causes where the disease condition is making the bone soft and increasing the risk of the fracture. If the due to the any other disease condition bone is fractured, we call that one as the pathological fracture. But also please do keep in our mind, fracture are primarily divided into the traumatic and the pathological. Traumatic means due to any trauma. Okay, so like overuse, road traffic accident, falls. So these are the traumatic fracture. So due to the disease conditions like osteoporosis, osteomalacia, rickets, and multiple myeloma and hyperparathyroidism, so these conditions making the bone to get loss of its density, and which conditions makes the bone to feel weak and fragile. So that is the fractures are happening due to the disease conditions. We call that as the pathological fracture. So here the 3 or 4 very important words I want to tell, please to keep in your mind. One is the avulsion fracture, that is the fracture has happened and the fragment is still in a contact with the body because of the tendon and ligament attached to that one. That's the avulsion fracture. Impacted fracture, one part of the bone is telescoped or the driven into the another part of the bone, that is the impacted fracture. And the comminuted fracture, where the broken bone is separated into the more than 3 fragments, that is the comminuted fracture, is very important. And so there is a complicated fracture, where the fractured bone is created the heavy pressure on the nerve or the vessels of the body, which created the complication. And the open fracture called closed fracture. In the closed fracture, the skin is not broken, skin is intact. In the open fracture, skin is broken and skin is like bone is came out of the our what you can say body part. Okay, so that is through the skin. So that is very important, you have to keep in your mind. And here it comes to the next question for your excellence mind. So please do read the question, analyze the question, don't make any gutbud. Already discussed the point, so I want every one of you to choose the correct answer. So this is important question, and from my side take this one as the 10-star question. Okay, so important. Read the question carefully and choose the correct answer. So there is no gutbud. What you will practice today here and you will do tomorrow in the exam. So I want every one of you to give the daily mock test without missing, and immediately, not later. You are completing the test at the 10:30 in the morning, 10:30 your entire 100 question revision should start immediately. Fatafat, whatever the questions you have like gone through, or whatever the correct answer you have chosen, whether it is the correct or wrong, immediately after the submitting class, even if you are taking 30 marks out of 100, 40 out of 100, and you are taking the 80 or 70 out of 100, don't neglect the questions revision. So that is, then only it will be helpful for you all. Okay, it takes time, but it will be effective in the exam. Okay, so that one you have to keep in your mind. We have to go with the effective way. Are you getting the point? So we have to go with the way which is giving the marks to us. Okay, yes sir. So please do read the question carefully and try to choose the correct answer. There is a 6-year-old child is there who falls while playing and hand on his hand, like especially forearm. So there is the 6-year-old child is there who falls while playing and so lands on his arm, especially on the forearm. 6-year-old child is there who falls while playing okay, so and he is landing on his forearm. Okay, so he is falling and he is landing on his forearm, and he presents with a pain and mild swelling. Now this particular child is presenting with a pain and mild swelling, and X-ray is showing that there is one cortex of the radius is broken while the opposite cortex remains intact and bent. So what type of the fracture is this one? Very important. So what happened here? The child, the 6-year child, okay, so especially this is the question of the pediatric. Okay, so there is a 6-year child who is falling while playing and he lands on the forearm. So he presents with the pain and mild swelling, and X-ray showing that one cortex of the radius is broken and another cortex of the radius remains intact and just it is bent. So what type of the fracture is this one in the children's, especially in the children's? So this is the transverse fracture I told beta. So how the transverse fracture happens? So there is in the horizontal cut of the bone, that is the transverse fracture. There is in the like oblique cut on the bone or the diagonal cut on the bone, this is the oblique fracture. Okay, there is just line on the bone, that is the linear fracture, right? So this one we have done already. This one we have done already, right? So this is not a fracture which is given here. Then the option B is the comminuted fracture. But a comminuted fracture means the bone are getting separated into the 3 separate fragments. Okay, so, sorry, there are the more than 3 like parts are there in the broken bone. So that is the comminuted fracture. Okay, so this is also not an answer for this one. And option C is the green stick fracture, and option D is the spiral fracture. Spiral fracture, I told that the twist is there. There is a twist is there. That is the spiral fracture. So this answer goes to the yes. 100% every one of you given the correct answer. That is the green stick fracture. This is the green stick fracture. But there are the 2 very important fractures you must and you should know before the exams. That is, one is the green stick fracture in the children's and the Buck's fracture in the children's. Okay, so remember like this, very important. There is a torus fracture or the buccal fracture we can say. Okay, so these 2 fractures are very important for your exams, where this is the radius. This particular radius is now bent one side because of the child is fell during the playing and he landed on the forearm. So there is pressure is created on the forearm and there is in the there is in the pressure on the our radial bone. Okay, so one side of the radial bone is got bent and another side of the radial bone is got broken. This is what you call the green stick fracture. This is what you call the green stick fracture. So where due to the pressure there is no break, but there is in the due to the pressure there is in the like buccal is creating here. So this is you can see. So this one we call it the torus fracture. So what happening here in the green stick fracture and in the buccal fracture? So there is in the incomplete fracture with one side of the cortex is broken and another side of the cortex is bent. That is the green stick fracture. And in the torus fracture, what happening? There is just a compression injury there, which is causing the cortical to just buckling, not breaking. Just buckling means there is what we can say 2 very important things when you come and like hit like this. So there is in the buckling will form. Okay, you can see it. So there is outward stretches there. So this one we call this is the area as a buckling area. Okay, so are you able to see this one? Yes sir. So this buckling is happening. So this is called as a torus fracture or the buckling fracture in the pediatrics. Okay, so there is no any break is there, right? So very important. Without any complex break, so this is the, or without any complete break, there is no complete break. There is in the cortical buckling is there. Mechanism we can say means there is just bending force is there on the green stick, and there is the axial compression means the axial means central compression is coming on the bone. So because of the central compression on the bone, so there is in the just buckling is happening. So cortex involvement, one cortex broken, another cortex is bent, and cortex is intact with the buckling. Okay, there is no any cortical break in the torus fracture or in the buccal fracture. So I hope the concept is very much clear to every one of you on the green stick fracture and the torus fracture. But the torus fracture we also call as the buccal fracture, because here due to the compression, there is especially at the center of the bone, at the axial part of the bone, there is in the compression is there. Because of that one, there is in the buckling in the bone is there. So we call it the torus fracture. Are you getting the point, beta? Yes, sir. The next question is here. It is waiting for your excellent answer. So please do read the question carefully, completely, and try to choose the best answer for this particular question. Yes, again, very simple question and very important question. There is a 62-year-old man is there who is presenting with a fracture of the femur. So after the minor fall from the standing height, so what happened? There is in the 62-year-old man is there. So this particular man is falling and he got the fracture at the femur. So now X-ray is showing that there is in the lytic lesion is there at the fractured site. Means there is in the weak bone which is showing that the bone is got lysis or the bone it got lesion. Okay, so the physician is suspecting that there is in the pathological cause for this fracture. Which of the following is not a cause of the pathological fracture? So I told the fracture we have the two types mainly. One is very importantly traumatic fracture, another one is pathological fracture. So traumatic fracture in the sense due to the road traffic accident, due to the falls, so due to the force, there is an injuries there. That is a traumatic fracture. So that traumatic fractures may happens to anyone. So who is high risk means for the drivers or the anyone. To me also, to you also, it may happen. That is the traumatic fracture. But the pathological fractures will happen to only those people who are having the high risk of the loss of the bone mineral density. Means the bone strength is decreasing. So when and what are the conditions where the bone strength is reducing? So there may be a case of the post-menopausal woman. So in that woman, you know there is a estrogen is very less, and you know that for the making the bone very strong and for the bone anabolism, we require the estrogen. So post-menopausal woman, no estrogen, so no anabolism of the bone, and there is in the catabolism of the bone where the all the density of the bone is reducing. Or else due to any other reasons, like there is in the case of the hyperparathyroidism. Okay, there is a case of the hyperparathyroidism. So that particular hyperparathyroidism case where there is a PTH is high, you know the PTH what it will do? It will reduces all the calcium from the bone, and it will increase the calcium in the blood. So that is the work of the parathyroid hormone. Are you getting the point, Pata? Yes, sir. So here, what happens whenever there is in the examination we will do, especially by the X-ray, there is the lytic lesion is there at the fractured site, and physician is suspecting that there is in the pathological fracture. So just you can say that which of the following is not a cause of the pathological fracture. So here option is the osteoporosis. But in the osteoporosis, what happens? There is a loss of the mineral density. So because of that one, there is in the pore form, means there is in the holes will be forms. So that is what again the osteoporosis means the density strength of the bone is reducing. Okay, this may be due to any reasons. Okay, so that is the when the bone is lost its density, means it is a weak. So weak bone is getting fractures, means due to the other disease condition fracture is happening. So that is what we call the pathological fracture. Pathological fracture means it is not due to the trauma, due to any other disease condition. Okay, so it may happen due to the osteoporosis, because in the osteoporosis weak bone is there, and any other cancerous condition which is getting metastasis to the bones. So that time also bone may get fracture. Osteomyelitis, infection, inflammation of the bone and bone marrow, so which may also cause the pathological fracture, because of the there is in the concept called as the sequestrum. So what is the sequestrum? Sequestrum in the sense, due to the infection and inflammation, so the part of the bone fragment is getting dead. So the dead bone fragment in the osteomyelitis we call the sequestrum, and we will do one surgery in the osteomyelitis, that is the sequestrectomy. So removal of the dead portion of the bone, that is sequestrectomy. Yes, so the osteomyelitis is causing the sequestrum, that is the dead portion of the bone, which increases the bone to get fracture. Bone metastasis, where the infection is there in the any other part which is coming to our body. Okay, bone metastasis means the cancer is there in the any other part, that cancer is spreading to the a particular portion of the body, and which is get metastasis, and the bone is got weak now, and that may causing the a very important, what we can say as the metastasis and weakening of the bone, and the patient may got fracture. And osteoporosis, I told, that is the bone are getting mostly weak here in the osteoporosis because of the loss of the mineral density. So that is the osteoporosis. And very importantly, pathological fracture. So this pathological fracture will not happen. Okay, so due to the road traffic accident. So road traffic accident which may causes the traumatic fracture, not a pathological fracture. Okay, so in the question also they are asking which of the following is not a cause of the pathological fracture. The road traffic accident is not a cause of the pathological fracture. Just give me a 30 seconds. There is a technical error there. Okay, so I will be back in a 30 seconds. Just stay connected. Okay, fine. So the question was asking which of the following is not a cause of the pathological fracture. The road traffic accident is not a cause of the pathological fracture. So this is the cause of the traumatic fracture. So I hope it is very much clear. Now I will revise all the very important causes and its related golden points that may causing the pathological fracture. So please do pay the special attention. I am not only revising the words which will help you to understand the pathological fracture. I am revising all the golden points and concept on that particular causes of the pathological fracture that may help you to choose the correct answer in the other questions also. So let me start that particular points. So please do pay the special attention now here. So important causes of the pathological fracture. The first one is the osteoporosis. How osteoporosis will lead to the pathological fracture? So first to understand what is the osteoporosis. This is the weakening of the bone. So this one will happen due to the reasons called as the aging process. So there is more age means more weak of the bone, and post-menopausal woman. So due to the decreased estrogen. So tell me that very important. So if the estrogen is decreasing means what happens? The risk of the osteoporosis will increase. Sir, why sir? Why? Because when the before post-menopausal period means during the adulthood, so the woman was in a reproductively active age. In that particular age, the woman was producing the good and well estrogen. So you know the estrogen is essential for the bone anabolism. It will help to keep and maintain the integrity of the bone. Okay, when the estrogen is reduced, that time what happens? There is no any hormone which is supporting the bone anabolism. So the bone anabolism is not happening means bone will start to resorb. So bone will start to catabolize. Okay, so that may causes the weak bone. So in the aging process or in the post-menopausal process, so there is in the reduced estrogen is causing the weak bone. So that is very importantly which will causing the decreased bone mineral density, and which may cause the pathological fracture. Okay, and very importantly what happens in the aging process, when the age will progress, that time there is in the increased osteoclast activity will be there. So what are the osteoclast? Osteoclast, osteoblast, osteocyte. Three words you have to must and should remember. Sir, what is the osteocyte? So that is the normal matured bone cell is called as the osteocyte. What is the osteoblast, sir? Osteoblast is the immature cell of the bone which is helpful for the forming the bone. Okay, that is the osteoblast. Cell involved in the formation of the bone is the osteoblast, and cell involved in the damage of the bone, so that is reducing the or which may causing the damage of the bone, we can say osteoclast. Okay, so osteoclasts are not a bone forming cells, those are the bone resorbing cells. Resorption means the calcium and minerals will come out of the bone. So that is the bone resorption cells are the osteoclast, and bone forming cells are the osteoblast. Normal mature bone cells are osteocytes. So these three words you have to must and should remember for your exams. Okay. So here what happens due to the aging process, increased osteoclast means increased bone resorption. So all the mineral is coming out. So this causes the bone to get demineralized and the decreased bone mineral density, which is causing the pathological fracture. So I hope it is very much clear on the osteoporosis. Remember, high risk of the osteoporosis is there in the post-menopausal woman, and in the reproductively active woman there is no osteoporosis. Why? Because they are having the abundant amount of the estrogen. Very important. Please do keep in your mind, right? Yes, sir. The next is bone metastasis. So this is the most common malignant cause of the our pathological fracture. And osteoporosis, what we have discussed, that one is the most common cause of the pathological fracture. So the three words we will understand here. So that is overall most common cause of the pathological fracture is our osteoporosis. That is the weak and mineral density is reduced. And the most common malignant cause is that is the bone metastasis. Any other cancerous condition gets spread to the bone. And the very important most common hematologic cause of the osteoporosis is the multiple myeloma. These are the three very important words, or the questions, or the one-liners you must and should keep in your mind, because from here you will get the questions. Are you getting the point, Buddha? Yes, sir. So here we'll see the bone metastasis. That is the cancerous cells are spread from the breast, or from the prostate, or from the lung, or thyroid, or kidney cancer, anywhere. So the tumor cells are spread to the bone, and which causing the structural weakness of the bone, which is causing the pathological fracture. Very simple. Okay. So the multiple myeloma next. So what is the multiple myeloma? You do know better. We have the bone. Okay, we have the bone. It is not looking like a bone. Let me draw it properly. So we have we have the bone. Inside the bone, we have the bone marrow. So inside the bone marrow, we have the plasma cells. Okay. So we have the plasma cells formation. So when there is in the excessive proliferation of the plasma cells, so this cancer of the plasma cells excessive proliferation, we call this one as in the multiple myeloma. So what is the multiple myeloma? Multiple myeloma is the plasma cell malignancy, or the plasma cell cancer. So this is excessively proliferating from the bone marrow. So now what happens when there is in the plasma cell cancer? So that time there is in the osteoclast activity also will be increasing again, which is causing the bone fragility, means weakness of the bone, and a pathological fracture. Very important, please to keep in your mind. The most common malignant cause is the multiple myeloma. Most common overall cause is the osteoporosis. Are you getting the point, Pata? Yes, sir. And in your question, in your exam, there is the lots of the time question asked about the multiple myeloma in relation with the fracture of the bone, and multiple myeloma in relation with the osteoporosis, multiple myeloma in relation with the hypercalcemia. Okay, whenever you know like multiple myeloma happened, means there is the osteoclast activity increased, means the bone is start to lytic. So all the calcium which is there in the bone, it is starting to come to the blood. Okay, so that may cause the hypercalcemia as well. Okay, so that is a very important thing to be keep in your mind. Next is I told the three words. Overall most common cause will be the osteoporosis. Most common malignant cause is the bone metastasis. So that is the very important thing to be keep in your mind. And the most common hematological cause will be that is the multiple myeloma. So these are the three very important things you have to keep in your mind. Okay, so most common overall cause osteoporosis, most common malignant cause bone metastasis, most common hematological cause multiple myeloma. So please do keep in your mind. Okay, next we have is the concept called as the rickets and osteomalacia. So now tell me the definition of the rickets now and osteomalacia now. So is that rickets and osteomalacia both are same? What I will tell is that rickets or osteomalacia both are same or different? Beta, rickets and osteomalacia pathophysiology may same, but the concept is means the age group is different, what we can say. So here you can see the rickets means the deficiency of the vitamin D in the children's. Osteomalacia means deficiency of the vitamin D in the adults. So in the children's vitamin D deficiency is happening. It means, vitamin D is must and should for the calcium absorption from the GI system. Where the vitamin D is not there, vitamin D deficiency is there. That time there is defective mineralization will be there, because vitamin D is not there, means calcium is not absorbing. No calcium absorption means no calcium will be sent to the bone, so the bone will be soft. That is what you call as the Malaysia. Malaysia, wherever the word it will comes, that is the soft you consider. So you will understand and you will study also about the other Malaysias, like we can say keratomalacia, means the our cornea become very soft. Okay, so Malaysia in the sense there is a soft. Okay, osteomalacia means soft bone is happening, which is happening due to the vitamin D deficiency. Vitamin D is not there, calcium is not absorbing, not absorption of the calcium, which leads to the soft bone. So that soft bone leads to the increased risk of the pathological fracture. So please do keep in your mind the points to be like understand. Here is the what is the record vitamin D deficiency in whom? In children. What is osteomalacia? Softening of the bone. Why? Due to vitamin D deficiency in whom? In adults. Okay, so these osteomalacia and rickets both are responsible for the contributing into the pathological fracture. Next comes to the point, that is the Paget's disease. So what is the Paget's disease? But this Paget's disease is a disease of the excessive bone remodeling, where there is the imbalance is there between the osteoblast and osteoclast. So what is the osteoclast? I told that is the bone resorption cell or the bone damaging cells are the osteoclast. And what is the osteoblast? The bones, the cells are which is responsible for the forming the bones. So bone forming cells are the osteoblast. So there is difference between the osteoclast, means there is in the like imbalance between the osteoclast and osteoblast, where there is in the osteoblast is more and there is the excessive, there is growth and remodeling of the bone. I told the osteoblast is not mature cell, it is the immature cell, where there is excessive remodeling due to the immature cells, the bone become weak, the strength of the bone is weak. So in the Paget's disease, what happens? There is excessive bone remodeling is there, because this is happening in the disorganized or the mosaic way, like it is the fragile way. Structurally weak bone we will get, and which may cause the deformity and which may cause the fractures. Very simple. Okay, so you can remember Paget's disease is the disease of the excessive bone remodeling, which is happening due to the imbalance in the osteoclast and osteoblast. This is a very important point you have to keep in your mind. Next we have is the hyperparathyroidism. So that is hyperparathyroidism. What it means, sir? So hyperparathyroidism means we have the thyroid glands here. We have the thyroid glands here. Just posterior of this thyroid glands, we have the small structures like a buttons. We have the parathyroid glands. So from this particular parathyroid glands, so there is in the release of the hormone called as the parathyroid hormone. That is the PTH hormone. So this parathyroid hormone, which is responsible for the maintaining the bone calcium level. Okay, it is responsible for the maintaining the bone calcium level. So which hormone is responsible for maintaining the not beta? So this is for responsible for maintaining the blood calcium level, not bone. Okay, so please do remember. I will tell how it will be regulated. Okay, so the parathyroid hormone is responsible for maintaining the blood calcium level. Okay, sir, how it will maintain the blood calcium level? So concept I have multiple time taught to you people. One more time I will revise in front of you all. So this is our blood vessels. We have inside this blood vessels we have the blood, and inside that blood we have the calcium. Okay, so that's the blood calcium level we have, and calcium we want in the blood also, we want the calcium in the bone also. Okay, so consider this is our bone, right? So here inside here we have the blood and here is the bone. So we want the calcium for the bone also, and we want the calcium for the blood also. Okay, so to maintain this blood calcium level, we have the hormone that is called as the parathyroid hormone. Okay, so what we call that one is the parathyroid hormone. And to maintain this particular bone calcium level, we have the hormone that is called as the calcitonin hormone. Okay, so from where this calcitonin will be released, sir? So this will be released from the parafollicular cells of the thyroid or from the C cells of the thyroid gland. Okay, so PTH will be released from the our parathyroid gland. Calcitonin will be released from the thyroid gland parafollicular cells, or the C cells of the thyroid gland, from where the calcitonin will be releasing. So what this parathyroid hormone is increasing, so what it will do, it will goes to the bone and it will destroys the bone and it will take the calcium from the bone to the blood. So that is the work of the parathyroid hormone. So if the calcitonin is increased, so what it will do, so it will comes to the blood, it will takes to the blood like calcium from the blood and it will deposit into the bone. So this is the work of the calcitonin. What the calcitonin will do, calcitonin will comes to blood and it will take the blood calcium from the blood and it will deposit into the our bone. So this very importantly here the hyperparathyroidism is happening, you consider. Means, so this parathyroid gland, which is means hormone which is going to the bone and resorbing all the calcium which is taking and which is bringing to the blood, and from here it is excreting through the kidney. Getting the point, beta? So if the parathyroid hormone is increasing, means the bone calcium will be decreasing. Getting the point? So bone calcium is decreasing, means risk of the fracture of the bone will be more. So that's the very important point, so you have to keep in your mind. So parathyroid hormone, what it is doing, if the parathyroid hormone is increasing, means increased bone resorption, so weakened bone, and which will causing the fracture. So this is how hyperparathyroidism will causing the pathological fracture, as a very important point, so you have to keep in your mind. Okay, yes sir. The next very important point is, that is the osteomyelitis, that is the infection of the bone and the bone marrow. So that is the myelitis. Osteo means that is the bone, myel means that is the bone marrow, itis means the inflammation or the infection. So osteomyelitis is the bone infection where the inflammatory destruction of the bone is happening and the necrosis is happening. So that is the bone is getting dead. So the dead part of the bone, that is what we call the sequestrum. So this sequestrum is the dead portion of the bone due to the infection. So there is bone portion is getting dead, means the bone is lost its structural integrity, bone is lost its strength. So that may causes the fracture here. Are you getting the point, beta? Yes sir. So osteomyelitis means most commonly infection is happening to the bone and bone marrow, which is causing the sequestrum, that is the dead portion of the bone. So that will causing the loss of the structure of the bone, which is causing the fracture. Getting the point? Yes sir. Osteomyelitis definition is important, that is the bone and bone marrow inflammation and infection, and we have the various points here in the hyperparathyroidism. This is the 4 button shaped glands which we have behind the thyroid gland, that is the parathyroid gland. So from the parathyroid gland there is the release of the PTH. That PTH is responsible for maintaining the blood calcium level. The golden points, blood calcium level will be maintained by the parathyroid hormone, bone calcium level will be maintained by the calcitonin. From where the calcitonin will releases, the calcitonin will releases from the thyroid gland, that is from the, we have the 2 cells in the thyroid gland. One is the follicular cells, another is the parafollicular cells. So follicular cells will responsible for releasing the T3, T4, TSH. Okay, sorry, T3, T4, that is the thyroxine and the T3 and T4 both hormones. Okay, and parafollicular cells of the thyroid gland is responsible for the or the C cells of the thyroid gland is responsible for releasing the calcitonin. Okay, very important, please do keep in your mind. And the parathyroid gland is releasing the parathyroid hormone. Calcitonin is responsible for maintaining the bone calcium and the parathyroid hormone is responsible for the blood calcium. Very important. Next point is, that's the Paget's disease. Remember what is the Paget's disease? In the Paget's disease, there is in the imbalance between the osteoclast and osteoblasts, where the osteoblasts will be more and which is causing the more and excessive bone remodeling, that is the weak remodeling of the bone. So structural weak bone is high risk of the fracture. The Paget's disease will be high risk of the fracture. Rickets, that is the deficiency of the vitamin in the children's. Osteomalacia, deficiency of the vitamin in the adults. So that may causes the soft bone, so that may causes the fragile bone to get fracture. And we have the multiple myeloma, there is excessive proliferation of the bone marrow plasma cells, so which is also deteriorating our bone marrow and bone cells because of the activation of the osteoclast, which may cause the bone to get fracture. And the most common hematological cause, because plasma cells are the part of the blood hematology. Okay, so most common hematological cause which is destroying the bone and causing the fracture is the multiple myeloma, and most common malignant cause is the bone metastasis. Most common overall cause is the osteoporosis. I hope you have understood all the definitions of the disease and how it will be directly indirectly involved in the pathological fracture. I hope it is very much clear to every one of you. And here it comes to the next and very important question for your exams. So please do pay the special attention and understand the question and try to give the best answer. This is one of the most important and very important 5-star MCQ for your exam. Yes, there is a 27-year-old man is there who is sustained a fracture of the tibia after a fall. So 4 hours later, what happened? He is complaining of the He is complaining of the severe pain that is disproportionate to the injury, right? And the pain increasing when his toes are passively stretched. The leg appears tense and swollen. What is the most likely complication of this particular fracture? The tibia fracture is happened here in the lower limb. Okay, so there is a sustained fracture of the tibia after fall in the lower limb. 4 hours later, after 4 hours, patient is complaining of the severe pain that is the disproportionate to the injury, and the pain is increasing when we are stretching the toes of the patient passively. Whenever we are pulling the toes, okay, so that time the patient's pain is increasing. The leg appears tense, means bulged, and swollen. Okay, so the tight and swollen leg is there. So what may be the most likely complication here? Option is the deep vein thrombosis. But a deep vein thrombosis may causes the tense and swollen leg. That is okay. But in the deep vein thrombosis, there should not be in the history of the tibia fracture, and there may not be a sudden severe pain that is starting after 4 hours of the fracture. So this is unrelated. Okay, so to DVT it is unrelated because here the pain is increasing 4 hours after the fracture. So this is not related answer. Next is the fat embolism. Whenever there is in the long bone fracture, the fat globules will enter into the circulation and it will suddenly travels to our circulation venous system, and it will enter into the our pulmonary vessels. So there is a pulmonary embolism may causes. There the patient will be having the sudden dyspnea, reduced saturation, and patches over the skin, like chest and axilla, and difficulty in the breathing. That is the fat embolism or the PES syndrome, what we can call fat embolism syndrome in the long bone fracture. That is the different situation. It is not related to this one. Okay, and there is a cellulitis, means there is inflammation of the subcutaneous tissue and underneath tissue. So that is the cellulitis. In that one also there is a tense and swollen is there, but there is no history of the fracture, and there is no pain, right? Like there is the fracture 4 hours, like this kind of the history will not there in the cellulitis. So I am removing the option D also, C also, A also, and the answer for this particular question is the compartment syndrome. So this is one of the very important point to be keep in our mind. So when the compartment syndrome will happen, when the fracture will be happening, consider this is the leg. Okay, so this is the leg. Here we have the muscle group, and when the fracture is happening, so here in between the muscle group there is increased, means in this particular compartment there is increased pressure. So this pressure, what it is doing, it is compressing the blood vessels, and it is compressing the nerve supply, so distal to the portion. This is the what we can call as the compartment syndrome. Because of the fracture there is increased pressure in the compartments of the muscles. So this increased muscle compartment pressure, which is like compressing the blood vessels also and nerve supply also. So this one, what we call this one as in the very important compartment syndrome. Okay, so you understand about the compartment syndrome here. So there is increased pressure is there within the muscle compartments due to the fracture. So this is compromising the circulation, which is reducing the circulation and decreasing the tissue perfusion. Because of this tissue perfusion reduction, there may be a ischemia and there may be a necrosis will happens. So are you getting the point, beta? Yes, sir. So because of this one, there is in the a very important thing I told, the blood vessels will be compromised and the nerve supply will be compromised. And there is increased pressure at the fractured area. Already there may be a pain due to the fracture, and on the fractured area due to the increased pressure in the compartments of the muscles. So there is the increased pressure which is created on the fracture area, which worsens the pain further. So the earliest sign of the compartment fracture will be compartment syndrome due to the fracture will be pain. So this is the asked question or the previous year question. You can remember. Okay, so there are the 6 P's you have to remember about the compartment syndrome. One is the pain, the earliest and the first and hallmark sign of our compartment syndrome, and there is the paresthesia due to the nerve compression. Due to the blood vessel compression, there is the paralysis, pulselessness, and the inability of the foot to maintain the temperature, that is the poikilothermia. So these are the very important points to be keep in our mind, the 6 P's of the compartment syndrome. Okay, so next we have the treatment for the compartment syndrome. That is the immediate and emergency fasciotomy. Means just we will open the compartment and we will try to relieve the pressure. So that is the emergency and immediate fasciotomy we have to do here. So this is very important. So what is the treatment of choice for the compartment syndrome? That is the fasciotomy. You know, in other situation where the compartment syndrome happens, so that is in the circumferential burn. Okay, so consider this is the hand, this is the hand, and the full length of the hand is got fracture. So this full circumference of the hand is got fracture, not length, full circumference of the hand is got fractured. So here the circle is constrictedly circle bend due to the fracture. So that one, what it is causing, which is causing the supply of the nerve supply towards the distal portion and blood supply towards the distal portion, because in the proximal area due to this constriction there is increased pressure. So in the burns, especially in the circumferential burns, also there is a compartment syndrome we will get, and there also we will have the emergency treatment, open the fascia and relieve the pressure, that is the fasciotomy. Are you getting the point, beta? Yes, so this is very important for your exam, so please do keep in your mind. Okay, so that is related to compartment syndrome. Here it comes to the next question for your excellence brain. So please do read the question, understand the concept, and try to give the best answer. Yes, so there is the 10-year-old boy is there. 10-year-old boy is there who is presenting with a fever and severe leg pain is there, and he is refusal to bear the weight. So what happened to the boy here? So he is just a 10-year-old boy is there who is presented here with a fever, severe leg pain is there, and he is don't want to walk, he don't want to bear the weight on that particular leg because he is having a very high pain there. Examination, we are examining that particular boy, and which is showing that there is a tenderness over the proximal tibia, and blood test reveals there is elevated inflammatory markers like ESR and the CRP. Okay, and X-ray is initially normal. What is the most likely diagnosis of this particular case? Tell the answer. Option is septic arthritis. Option B, osteomyelitis. Option C, osteoarthritis. Option D is the rheumatic fever. What may be the answer? Yes. There is 10-year-old boy is there who is presenting with a fever, severe leg pain, and refusal to bear the weight on the leg of the where it is getting pain. Examination is showing that there is the tenderness over the proximal tibia, and blood test we have done, and which is showing that there is an ESR and CRP raised. So option are like this here, beta septic arthritis. We have the arthritis. What is the arthritis? That is the inflammation of the joint, where the patient is telling the pain and tenderness, the tenderness over the proximal tibia, not in any joints. Getting the point? It is there in the proximal tibia, not in the joints. So remove all the inflammation of the joint from here, you will get the answer. Okay, so the pain is not in the joint. Are you getting the point, beta? Yes, sir. So osteoarthritis also, it is the pain of the inflammation of the joint. So I am removing that one. And rheumatic fever, it is completely unrelated because there is no any history of the post like streptococcal throat infection. There is no any history of the Major, minor, like John's criteria, any point is not there about this one. Okay, so I'm removing the option D also, not it is rheumatic fever, and answer B goes to the correct answer, that is the osteomyelitis. So I want every one of you to revise all the golden points which is important on the osteomyelitis, because these are the examiner favorite, and from here it may strikes in your exam. Osteomyelitis, sir, what are the golden points we must remember? So these are the golden points we have to must remember. Most common organism which is causing the inflammation of the bone and bone marrow, that is the osteomyelitis, is the Staphylococcus aureus. Very important point. This is the previous year question, the previous PYQ. Okay, and most common site of the osteomyelitis is the metaphysis of the long bone. So that is the reason the patient was complaining of the pain in the proximal part of the tibia. Okay, so that is not in the joint. So that because the most common site involved in is the metaphysis of the long bone is the most common site. So that is the reason the pain was there in the proximal tibia, not in the joints. Okay, so here there is in the, if you are not treating, which may lead to the sequestrum. So what is the sequestrum? The area which is involved in the osteomyelitis, that is the infectious part, it will get die. So the dead bone portion because of the infection we call as the sequestrum. So in this one we will do the sequestrectomy. So that is the surgical procedure in which the sequestrum, that is the dead bone fragment, we are removed in a case of the chronic osteomyelitis. Okay, so we are removing the dead fragment of the bone. So we call it one as the sequestrectomy. Are you getting the point, Bada? Yes. So these are the very important points for your exam. You must and should remember on the our osteomyelitis, because it is important. Okay, so I hope it is very much clear, and here it comes to the next question for your excellent answer. So please do read the question carefully, completely, and try to respond and give the best answer in the comment box now. Yes. There is a 25-year-old man is there who presented with the 10 days after the sustaining the closed fracture. So there is 25-year-old man is there who presented to our hospital 10 days after the sustaining the closed fracture. So 10 days back he was have the closed fracture of the which portion, especially tibia shaft. So shaft of the tibia, and now X-ray is showing that there is in the early soft tissue swelling is there. Okay, so there is an early soft tissue swelling is there, and which is formation of the granulation tissue around the fracture site. So there is in the just a early soft tissue swelling is there. Along with the swelling, there is in the formation of the granulation tissue around the fracture site. So there is no any visible hard callus, no visible hard callus. So which stage of the bone healing is this one? So this is the question from the stages of the bone healing. So very important for your exams, stages of the wound healing and stages of the bone healing. So stages of the wound healing already I have given in the high yield content list, where we have discussed the wound healing and update on the wound healing. There is the negative pressure wound healing therapy also we have discussed, that is there in your A1, A2 both plan. So please do watch that video, that is the update. Okay, very important, right? So here the first very important option we have is the hematostatic form, hematoma form. So this is the very important formation of the blood clot to stop the bleeding. So that is the hematoma formation, or the hematostatic is there. So that is the first stage in the wound healing also, in the bone healing also. And second one we have the inflammatory phase, where the swelling will be there. There are the soft tissue plus there is in the granulation tissue will form along with this one. So there is in the very importantly we can say as the soft callus will be formed, not hard callus. So hard callus will be forming in the third stage. Okay, so remodeling is the fourth stage. So it will be taking the lots of the time. So let me take you to a beautiful all the stages of the bone healing. So that is stage 1 is the hematoma formation stage, or the where the bleeding is get controlled in this particular stage as a very important portion, and duration will go for the 24 to 72 hours. And the second one is the inflammation of the fibrocartilaginous space. In this space there is a soft tissue like soft tissue or the soft callus is forming. So this is lasting from the 3 days to 2 weeks. And we have the third stage, that is the callus formation stage. Here the hard callus will be forming. That is taking a time of the 2 to 6 weeks. And we have the ossification or the consolidation phase, where there is the regrowth of the bone along with the complete mineralization is filling in the bone. That is the ossification is happening. It lasts for the 3 to 8 weeks. And there is the remodeling as the last phase. So that is months to year it will take, and the complete bone strength will be coming back to its normal. That is what you call the remodeling phase. Getting the point, beta? Yes, sir. In the question, what happened? There is a soft callus is formed, not a hard callus. Hard callus means that is the third stage. There is a callus formation stage. Here the inflammatory phase means that at the soft tissue injury will be there, means swelling will be there, and there is the soft callus formation will be there. So this is the stage 2. So in the question also, X-ray showing that the soft tissue swelling and formation of the granulation tissue are on the fractured side. So this thing will be happening in the inflammatory phase only. So that is not in the hard callus formation stage. So answer B goes to the correct answer for this particular question. So I hope it is very much clear to everyone of you. Okay, and here it comes to the next very important question. So that is waiting for your brilliant answer in the comment box. So please do read the question carefully, completely, and try to give the best answer in the comment box. Yes. There is a 6-year-old child is there who is presenting with the fracture of the shaft of the femur. Orthopedic surgeon decided to apply the temporary traction methods that uses the adhesive strips applied on the skin and does not involve the insertion of the pins into the bone. Which of the following traction is being used here? What happened here? The 6-year-old child is presented with us with a fracture of the femur. Okay, and the orthopedician is telling to apply the temporary traction. So that he is telling just apply the adhesive strips and apply the traction and do not insert the pin in this our bone. Okay, so what kind of the traction we applied here? Option is the skin traction, but in the skeletal traction is the option A. In the skeletal traction, what happens? We will break the skin, we will insert the pin into the bone, and we will apply the traction directly to the bone. That is the skeletal traction. And in the skill traction, what happens? What happens in the skill traction? In the skin traction, there is just no any insertion of the pin. We will apply the traction by applying the straps. Adhesive straps are the dressings we will make, and on that, for that one only, we will apply the pulling force. That is the traction. So that is the skin traction. In your option only, that is telling that you just orthopedic surgeons decided to apply the only adhesive strips and put the skin traction. So that is the skin traction goes to the correct answer, not a skeletal traction. So option B goes to the correct answer. So this is not a hollow and cervical traction. So you understand that cervical traction, hollow tractions both will be a part of our skeletal traction. Okay, so we will see some very important skin traction list here. We have the Buck traction, Briand traction, and Russell traction. So from here you may get the image based question. So I will show the images to you all. So just you have to tell me that which traction is this one. Okay, so the first traction is this one. Okay, so look at the image and tell the answer. This is the image number A. So tell the answer for this image number A. Beta, remember, here there is in the fracture of the femur is there. In this particular situation, we apply the traction, which is having the bidirectional pressure. One pressure you can see, which is vertically came and it came like this. Another one is just horizontal fracture, which is came down like this. So the bidirectional pressure is there. So this is what we call the Russell's traction. Sir, how to remember? You can remember like in the Russells, there is double S, double L is there. So there is the double S, double L is there. So when the double direction traction is there, so that is the Russell's traction. You can remember like this. So this will be helpful for your exam. Next, you can see this particular image. There is the only single direction pulling pressure is there. So what is this traction? What is this traction? Only one direction. You can see here. So we applied the bandage and the only one direction pulling force is there. So what is this traction? Yes, this traction is the image number B. So what is the traction name is? Yes, that is very important. Bucks extension traction. So please do remember, this is the Bucks extension traction. So next we have here in the children's we are using the traction. You can see here again in the hip or the femur fractures we are using where the we have applied the buttock above the ground and we applied the pulling force. Okay, so here remember beta, the child buttock should not touch to the this particular floor. It should not touch to the floor. So that is the very important, right? Yes, sir. So this one we call as the Bryant traction. What we can call this one as the, we call this one as the Bryant traction. So very important, right? The next is Bucks extension traction. So we have done that one, and a Bryant traction. We are using the Bryant's infants. Remember that is in the infants and children's. So we are using the Bryant traction. So next is the very important skull tongue and turning frame. So this is the just used for the a patient with the cervical and the spinal fracture. So that we will use the skull trunk traction. So we are directly inserted the, what we can say, pin into the our skull and we will pull with the pressure. So this is very important. Skull tongues and the turning frame we have here. Okay, and next one we have here is the, so this one Dunlop traction. So that Dunlop traction will be seen in which condition? So whenever there is in the humerus is getting fractured, so humerus fracture is there means that time we will use the Dunlop traction. So this is also a part of the skin traction. Okay, so next we have is, so in the Dunlop traction, remember there is the two directional fracture pulling forces there. One is to apply the skin, that is the skin traction. Okay, so from the above, and here we will apply the pin and the skeletal traction from the below. So this is a Dunlop traction we will use especially when the humerus is got fractured. So very important, please to keep in your mind. Next comes to the halo traction. So next, what is that? Next is the halo traction. So in the halo traction we will use whenever there is a cervical spine injury. So we don't want the cervical spines to get compressed. So this halo traction will be used, and the cervical traction beta. So again, when there is in the spinal cord injury, so we don't want the cervical spine and any other spine to get moved. So we will use the cervical traction here. So I hope it is very much clear to every one of you, right? Is that clear? This is the cervical traction. What I am showing the image, and this is the halo traction. Very important image. And this is the Dunlop traction. This is the Bryant's for the infants. Okay, and here we have the skull trunks, and here we have the Bucks traction, and here we have the Russell's traction. These are the tractions images you must and should remember. Okay, and try to choose the answer correct in the exams when it comes. Okay, so the next question is here for you all, and read the question properly, perfectly, and try to give the correct answer. Yes, beta, boring will happen to you also and me also, but this is the exam time. We should not have the time to get relaxed. Okay, so always keep motivating yourself. Okay, so some of you are trying with the second, third attempt, so still not clearing the exam. So means you are just quitting at the end. So don't quit the process at the end. Whatever the consistent preparation you have done from the day 1 to till here, so that one you have to boost and play the mind game and revise. So revision is the only thing which will make you a success, remember. Yes, so sometimes even our own parents may scold us, like they have the expectation like my son, my daughter will clear the exam this time, that time. So you are studying from the 3 years. Okay, no problem, keep up yourself in a high positive way and be with the friends who will talk to positive with you, so that everything will be fine in a day. So that is, you have to believe and move on, right? Yes, ಯಾವಾಗ ಬಿ ತಂದೆಯ ಕೋಪ ಸೂರ್ಯನ ತಾಪ ಯಾವಾಗ ಬಿ ನಮಗೆ ಸುಡಾಕಿರಂಗಿಲ್ಲ, ನಮಗ ಕೆಟ್ಟದ ಬಯಸಕ್ಕಿರಂಗಿಲ್ಲ. ತಂದೆ ತಾಯಿಗಳ ಕೋಪ ಮತ್ತು ಸೂರ್ಯ ಕೊಡುವ ಶಾಪ ಯಾವಾಗ ಬಿ ನಮಗೆ ಬೆಳಕಿನ ದಾರಿ ತೋರ್ಸಕ್ಕೆ ಇರುತ್ತೆ. ಸೊ ದಟ್ ಒನ್ ವಿ ಹ್ಯಾವ್ ಟು ಬಿಲೀವ್. ಓಕೆ, ಸೊ ಲೈಕ್ ಅವರ್ ಪೇರೆಂಟ್ಸ್ ಆರ್ ಸ್ಕೋಲ್ಡಿಂಗ್ ಅಸ್ ಮೀನ್ಸ್ ದಟ್ ಇಸ್ ನಾಟ್ ಅ for the any bad thing. So that is also good for the good thing only. You have to keep in your mind, right? So never ever give up. You have started the journey, you have to end it with a victory. Okay, yes, there are lots of the aspirants who have started and they have quit in the halfway, so they will never ever get succeed. So the a person who will maintain the consistency. Better, there are the lots of even my friends, so they have taken the 4, 5, 6, 7 attempts. So now they are in a very good position with a very best rank. So, and that the only thing what I want to say is, if you are doing the really hard work, it will definitely pays you one day. Just you have to believe in yourself, maintain the consistency, and thanks to the all the surroundings which is helping to you, and move on. So that will definitely, it will boost you. Okay, yes, getting the point, beta. Yes, the bore will happens to you also and me also. So that is the normal process. Just if you are having the bore, just take a cup of the water and drink it. That's it, and move it. Okay, so just read the question and give the correct answer. So that is very important point again here. This kind of the questions you will get in the Norcet 10. Okay, what is the next nursing best intervention? What is the next nursing step? What the nurse will do next? So this type of the questions. So this time we are hitting all the portions where the one liners, concept based, scenario based, priority based. Okay, so nursing intervention based, medical treatment based, medication based, drug based. So everything we will go with approach, and we will apply the concept, the answer will come out, and along with that one ranks also will comes out. Okay, yes. So here is the question. A 14-year-old boy has the plaster of the Paris. Okay, so means POP cast is applied here for a fracture of his forearm, and 2 hours later, means after the 2 hours, he complains of the severe pain which is not relieved by the analgesics. So after 2 hours of applying the POP, the patient is complaining sudden severe pain which is not reducing due to the drugs. His fingers appear swollen and cold. But a cold means blood supply is not there. We applied the cast here, so the distal portion is not getting the sufficient blood, and the capillary refill time is delayed. So again, which indicates that classically there is no blood supply to the distal portion. What is the next appropriate immediate nursing intervention you have to do? So ಏನು ಮಾಡ್ತೀರಾ ಇಲ್ಲಿ, very important ಆಗಿ choose your correct answer. So what you have to do here, plaster of the Paris cast is applied, and the 2 hours later the child is complaining you that there is a severe pain which is not relieved by the analgesics. His fingers appear swollen and cold, and capillary refill time is delayed. So what is the appropriate immediate nursing intervention? So choose the correct answer. Option A is telling that there is elevated limbs, and option is there that elevate the limb and reassure the patient. Beta, already there is in the reduced circulation, and you are keeping the limb elevated, it will again reduces the circulation, and it will makes the further worsening of the ischemia and necrosis. So this is not our answer. I am eliminating the option A. So next comes to the option B. There is apply the warm compression. Here this much severe pain is happening, where I have given the analgesics also. Even after giving the analgesics, pain is not reduced. Means is this will reduce by hard application? No, sir. So don't give the silly answers which is like not making the sense. Okay, so the next is option C. So the option C is split or bivalve the cast and immediately inform the doctor. Option D is encourage the active finger movement only. But a active finger movement we will encourage when the everything is fine, means there is no heavy tightness of the POP, and there is the distal blood supply is well and good. So that time we will encourage to move the fingers. So here there is in the blood supply to the peripheral part, to the distal part of the cast application is reduced. In this one, this active finger movement you are telling the patient will do, that one again the blood demand will increases, again the pain will worsen. So the option D also going to inappropriate answer. Option C goes to the best answer here. Immediately nurse should open that particular POP and inform the doctor, because what happened here, the blood supply towards the peripheral portion or the distal portion of the cast application is compromised. So that time it may causes the ischemic injury and permanent necrosis of the portion. Okay, so that we don't want. So immediately we will remove the, or we will cut or split or bivalve the POP cast, and we will inform the doctor. So this is going to be a very important correct answer. So please do remember. Okay, so yes, notes of this particular class will be provided in the Telegram group, so you can join to our Telegram group. The link I will give in the description box. Okay, and keep on practicing the MCQs. Very importantly, from the daily live test, what we are giving as a Super 60 in the Master Nursing class application. So app is there for you all. So download the app from the Google Play Store. The link I have given in the comment box. Okay, you can keep on practicing the MCQs. Okay, that is definitely going to helpful for you all. Okay, so split or buy one of the cast immediately and inform the doctor is going to be a correct answer, because we want to just immediately re-establish the last circulation. That is the priority here. So option C goes to the correct answer. Okay, so the very important things you have to keep in your mind here, that is related to the POP cast, and the another type of the one more cast we have, that is the fiberglass cast. So these two are the very important points. So you just have to remember and keep in your mind, that is, so this POP we are using where, sir, where means there is in the damage of the bone in the orthopedics. Okay, so when there is in the fracture or the soft tissue injury, so this is the material which is made up of the calcium sulfate. So this material we are using in the orthopedics or in the like in the orthopedic wards or the OPD. So just to immobilize the fractured part and any soft tissue injury is there, so that particular part we want to immobilize, there we are using this particular POP. And what is the composition for this one? The composition for this one is the calcium sulfate is the composition for this one. We are like the POP is having the, what is the composition of the POP? So this is the very important you have to keep in our mind. Composition of the POP, the previous year question, that is made up of the calcium sulfonate. So they will give the calcium gluconate, calcium carbonate. Don't choose anything. So that is the CS. Okay, so remember CS, calcium sulfate is the composition of the POP. Okay, so here we have the two types of the cast that is must and should remember. Okay, one is the synthetic one, fiberglass class. Another one is the, we have to like prepared composed of the calcium sulfonate, that is the POP cast. Okay, so there is the two type of the cast. What we have is the plaster of the Paris, that is the plaster cast, and the fiberglass cast. So remember that better. Our plaster of the Paris or the POP is made up of the calcium sulfonate, and the fiberglass class is made up of the synthetic fiberglass. And when we apply this one, it will take for the dry for the 24 to 70 hours. It will take to get dry and fit to the our body, and this particular fiberglass class, it will get fit within 30 minutes or up to 45 minutes maximum. Okay, best answer is within 30 minutes. Okay, so material is the calcium sulfonate here. Sorry, calcium sulfate here, and the synthetic one will be there in the fiberglass cast. So that will be fiberglass only, it will be there. And the cost for the plaster of Paris is the very less costly. Okay, and we can use this one in the like for the short duration, and fiberglass cast is the very costly. So this one we can use for the long duration. And if you ask me, sir, what is the weight of the POP? POP weight is heavy and it is more weightful, and the fiberglass is very lightweight. Okay, so next we have is the whether the POP is water resistance or no, better. POP is not water resistance. If you are putting the water, so it will absorb the water, it will not water resistance. Okay, but the fiberglass class is the, that is the water resistance. And drying time, once we apply, the POP will take to get dry is the 24 to 72 hours, and the synthetic material, that is the fiberglass, it will get fit within 30 minutes. Okay, so the next strength will be less durable, that is the POP, and more durable, that is the our fiberglass class. So that is the reason fiberglass class is more costly as compared to the POP. Okay, and fiberglass cast, it will fit within 30 minutes, and the synthetic, that's the, sorry, our POP will take around the 24 to 72 hours. This is a very important point to be keep in our mind. Okay, so this is very important points. From here you will get the exams point. Okay, so water resistance, so this is less costly means not water resistance, so it's more costly means they will give the water resistance also, right? So heavy is the our plaster of Paris is the very heavy in the weight, and the lightweight one will be the fiberglass. So that is the cost of the our fiberglass is costly because it is having the lightweight, water resistance, and remain like it will get easily dry within 30 minutes. So this is fiberglass class, right? So there is the, this is less costly because it's very heavy, not water resistance. It will take 72 hours or the 24 to 72 hours to get dry. So that is the less costly. So POP will be made up of the calcium sulfonate. So these are the calcium sulfate. These are the very important points you have to keep in your mind. Okay, so from here you may get the question from that particular table. And remember the very important points, that is what are the nursing interventions you have to follow. So whenever you are applying the POP and whenever you are taking care of the POP, so very importantly better, during the application of the plaster of the Paris, so you are applying the plaster of the Paris that time, so we have to use our palm, because if we are using the fingers, so our fingers may create the pressure points. Okay, so because we are pressing like this means here it is creating the gap is there, so this gap will be not pressing and the finger will be pressing, so which creates the pressure points. To prevent the indentation and the pressure source, so we have to use the palm while applying, not the fingers. Remember, don't apply the POP with the fingers, apply the POP with the palms, because it will be having the clean surface where it will spread the equal distribution of the pressure and there is no any pressure points. Okay, I hope it is clear. Next is we have to maintain 1 to 2 finger gap above and below the cast, because the blood should go inside easily and blood should come outside easily. So if you are not maintaining the 1 to 2 finger gap above and below, the blood supply may get restricted, very importantly, right? So plaster of this one we have to use the palm of the hand, not the fingers, because the finger you are using means it will create the indentation, that will create the pressure source. If you are using the palm, it will prevent the indentation and it will prevent the pressure source. Are you getting the point, beta? Yes, sir. Next is maintain 1 to 2 finger gap above and below the cast. This is also very important. And apply the stonic agent to prevent the skin irritation. So we directly don't apply the POP on the bare skin. So first we will apply the tourniquet soft roll, then after that on that one we will apply the POP, because if you are applying directly POP, that will irritate the skin. Okay, that we don't want. Are you getting the point, beta? Yes, sir. Next is after application of the POP, we do not cover the cast until it will be completely fully dry. If it is still wet, you are covering means, so there is the infection will be there at the site of the fracture or the site of the injury, and support on the firm surface, not on the a surface which is not unequal or the asymmetrical surface you are keeping, so it will bend like a surface which you are keeping. So always keep this one in the firm or on the straight surface, and elevate the limb on the pillow for the initially to reduce the swelling. If in case there is no any circulation compromise, that time we can eliminate to reduce the swelling of the fractured portion or to increase the venous return. If there is any blood supply is compromised, the arterial supply is compromised, that time don't elevate it. Are you getting the point? Yes, sir. Next is avoid elevating the amputated stump or the amputated leg. We should not elevate excessively for the prolonged time, because it will cause the skin contraction, that one we don't want. Okay. Yes, sir. The next is neurovascular assessment, means the nerve function is there or not. Vessel function means the blood vessel is functioning or not. So that is the neurovascular assessment we have to do. So how we have to do? Just here you consider we apply the POP and this is the foot you consider. So here is the POP we applied and this is the distal portion of the POP. Okay, in this particular distal portion we have to check the pulse. If the pulse is there, means the blood is coming well, good, okay. So if the pulse is not there, so that indicates that the blood supplies get compromised by the tight POP. That is the very important point you have to keep in your mind. Okay, so the distal portion, assess the distal pulse, both the side. So the right side coming 60 means left also should come 60. Left, right is 100 means left also 100. The equal pulse should we will get in the both the legs. Okay, so we will take a distal pulse of the both leg and we will compare. Okay, and next is check the capillary refill time, the CRT. Capillary refill time you have to check. If it is more than 3 seconds which is going, that indicates the circulation is reduced. If the capillary refill is coming back to the normal within 3 seconds, that is good circulation we have. And we will assess for the color, temperature, sensation. So the temperature is reduced, cool, calm, that indicates the blood supply is not there. Okay, and sensation is not there, means nerve supply is compromised, and which we have to watch for the pain out of the proportion, means the sudden increased excessive pain is there. So that is not relieved by our medications also, that indicates the compartment syndrome. So that time we have to go for the immediate emergency fasciotomy, remember. And if there is any neurovascular compromise is there at the POP applied site, so that the pulse is not there or the sensation is not there, so that time, or there is any infectious sign like from the POP the pulse is discharging, excessive irritation and itching. Okay, so there is any neurovascular compromise or the infection signs. So that time we have to remove the or we have to split the cost immediately and inform the doctor. So this is the very important points you have to keep in our mind. Okay, split the cost and inform immediately to the doctor. So these are the very important points you have to keep in our mind. Any neurovascular compromise or the infection signs, so that time you have to immediately remove and inform the doctor. So this is the very important point you have to keep in our mind, right? The next question is here. I try to read the question for your exams and try to give the best answer. Yes, there is a 24-year-old man is there who is admitted after the road traffic accident with a closed fracture of the shaft of the femur. So the long bone femur is got fractured here. So remember better, there is a 24-year-old man admitted after the road traffic accident with a closed fracture of the shaft of the femur. And 48 hours later, so what happened here? 48 hours later, he is developing a sudden breathlessness, confusion and petache there over the chest and the axilla. His oxygen saturation is 82 on the room air. And what is the most likely undergoing mechanism which is responsible for this particular condition? So what happened to him where there is in the after 42 hours of the fracture, suddenly he is getting the breathlessness, confusion, petaches over the chest and axilla. Oxygen saturation is dropped to the 82 on the room air. What is the most likely cause of this very important situation? What is the cause of this one? Option A, there is in the direct thrombus formation from the deep vein. Better the thrombus formation will not happen after femur fracture. So there is the formation of the emboli. That one is the fat emboli. Okay, so the air emboli risk will be there when there is the insertion of the central veins, removal of the central veins. Okay, in that particular situation, if the sudden breathlessness, confusion, petaches over the chest and axilla, that indicates there is an air emboli. Or else if the patient is already having the swelling over the legs, especially in the calf muscles, the pain, temperature is there because of the DVT. So already existing patient of the DVT is getting sudden breathlessness, confusion, petaches over the rest. That indicates that is in the a thrombus which was there in the deep vein is got dislodged and it become converted into the pulmonary embolism. So that is the blood clot will be there in the DVT. So here very importantly in the fractured cases, there is in the fat embolism. Means from the bone marrow there is in the globules of the fat. So fat globules will be released into the bloodstream and that fat globules it is going into our lungs and which is blocking the pulmonary vessels and not only blocking the pulmonary vessels, here the fat globules are there. Means this one will form the free fatty acids. So that free fatty acids will damages the interstitial space of our lungs and which will causes the ARDS like symptoms. So that is the very important thing to be keep in our mind. Okay, so here the road traffic accident, femur fracture, and 48 hours later the breathlessness and confusion and petaches over the chest and axilla. So these are the breathlessness, confusion and chest and axilla, petaches. These are the classical sign of the pulmonary embolism which is happened here. If there is history of the fracture, fat embolism. If history of the DVT already existing, that is the blood clot embolism. If there is history of the insertion of the central veins and removal of the central veins, the air embolism risk will be there. So you have to keep in your mind. Okay, so option A is the direct thrombus formation from the deep vein. So this is not a correct answer because here the fracture is there in the history, and option B is the air entry into the venous circulation. So this happens due to the insertion of the central vein, not during the fracture. But in the fracture, the highest risk will be release of the marrow or the fat globules into the bloodstream. So this is the most common underlying important cause you have to keep in your mind. From here, you may get the question in your exam. Are you getting the point, Buddha? Are you getting the point? Yes, sir. So next is we have the septic emboli from the impacted fracture site. So this will immediately not happens within 48 hours. It will take a huge time for the form to infection, and after infection to get convert sepsis to emboli. That will take a many time. So here immediately means in the within 48 hours means like 24 to 72 hours. So the These kind of the symptoms are happening means there is the PES we can say, or the fat embolism syndromes we can say. So remember beta, so there is in the fat embolism syndrome we have, that is the PES, which is classically occurring 24 to 72 hours after the long bone fractures, especially shaft of the femur. Okay, and here there is a classical triad, it will be manifesting with, that is the respiratory distress, where we have the sign of the hypoxemia, wherein the patient is having the less than 82% of the saturation in the room air, and the neurological sign which is showing that there is a confusion and agitation because of the blockage of the like there may be a blockage of the vessels which is going to the brain, or else there is in the hypoxia because of the pulmonary embolism, and there is the petechial rashes especially over the chest and axilla and conjunctiva. So this indicates that there is in the PES is there, or the fat embolism syndrome is there. So this is the very again very important for your exam, so please do remember about this one. Okay, and I told there is the free fatty acid which is going to the lungs, it is not quite, it will not sit quietly, it will try to damage the interstitial space where we will take the x-ray. So we will get the diffuse bilateral infiltration, and that looks like a strong snowstorm appearance. So this is the x-ray classically we will see in the acute respiratory distress syndrome. So this bilateral infiltration we are getting after the fracture means that is due to the pulmonary embolism, that the fat emboli is reached to the lung, and the free fatty acids are trying to damage the interstitial space of the lungs, where the diffuse bilateral infiltrates and snowstorm appearance have been seen as a classical picture after the fracture. So that indicates again supports the diagnosis of the test, that is the fat embolism syndrome. Okay, so that's the very important to be keep in our mind. Okay, next we have the treatment. So we will supportive treatment only, that is the oxygen we will do, and we will keep ready the mechanical ventilator if required. And most importantly, you have to keep in our mind, if you are early stabilizing the fractured site, that will not form the fat embolism, and that will not causes the fat embolism syndrome. So if early fracture, if you are stabilizing and if you are immobilizing the fractured site as soon as possible, so that will reduces the fat embolism syndrome. So I hope it is very much clear to the every one of you, right? Is that clear, beta? Yes, sir. The next question is here in front of you. So please do read the question carefully, completely, and try to give the best answer in the comment box. Fadafat. Every question we are discussing here is the golden question. So that is most importantly you have to keep in our mind, and from here you may get the direct question in your exams. Okay, and the concept is must to remember. The concept are the key, and the concept is the things which will makes you to choose the correct answer very easily. Okay, so here's the question, and in the question you can see there is the old age people is there, the 62-year-old woman is there. Okay, so she is having the chronic knee pain, so that is worsening with activity. Whenever she will do the activity, so that time the pain is getting increasing, or the pain is getting worsening in the 62-year-old woman. Okay, so in the old woman, that is 62-year. Okay, so here it may be the menopause may happen. Okay, right? So bones become weak, and the bone cartilage becomes weak, and the surface, the articular surface of the bone may get weak, and there may be a heavy use of the bone, because since from the last 62 years so she is using the joint. Okay, so that is maybe she used the heavy work she have done during her young age. Okay, so that one may causing this particular pain at the rest. Okay, sorry, so that may causing the pain at the knee. Okay, so that rest will be okay. So since whenever she will do the rest, that time she is okay, and whenever she will do the activity, that time pain is increasing. So the next is the next very important thing is she is complaining that morning stiffness is there, that is lasting less than 30 minutes only, and X-ray is showing that there is in the narrowing of the space in between the joints, and osteophytes are formed here. So what is the most common type of the arthritis is this patient is having? So option A, rheumatoid arthritis, option B, gouty arthritis, option C, osteoarthritis, and option D is the septic arthritis. What is the correct answer? Yes, what may be the correct answer? Beta, I will clear this concept, and you will able to choose the all the type of the arthritis very easily after understanding this particular question. Stay connected, listen carefully, this is important. There is in the old age people is there, 62-year-old woman. So she is having the chronic knee pain that is worsening whenever she will do the activity, and improves the, means there is no pain when she will do take the rest. So she is complaining that morning stiffness is there, means early morning whenever she will wake up, that time there is in the stiff joints will be there, but that will be only less than 30 minutes. And X-ray is showing less space or the space narrowing in between the joints, and osteophytes also formed in the joints. So what may be the type of the arthritis is this one? This is the question. Remember beta, there is in the a concept where we can see this is the bone and this is the another portion of the bone. So this particular surface we call as the articular surface, because this particular surface which is involved in the process of the making the joint. So this is the articular surface, I will say. And here we have the articular cartilage to the both end. Okay, so here we have the articular cartilage to the both end, and in between of this one we have the synovial fluid. Okay, and inside the synovial fluid we have the hyaluronic acid, so that is maintaining the viscosity and maintaining the lubrication, and which is not allowing to like rub the both ends. So whenever I will walk, my joint will move. Okay, so that time my both ends of the bone is not rubbing, because the end of the bone is having the articular cartilage and end of the our moving joints. So we are having the synovial fluid, and inside that one there is the hyaluronic acid which is maintaining the lubrication. Okay, there is no rubbing. But when we will use this one for the prolonged time, for the 60 years, 70 years, because of the age process, the degeneration of the our articular cartilage will happen. Okay, so this articular cartilage which is there here, so this will start to get damaged. Okay, yes sir. So now articular cartilage is got damaged, and the synovial fluid may get reduces, and no synovial fluid means there is no hyaluronic acid. So one part of the bone, it will be coming and in direct contact with another part of the bone, and there is a rubbing between the two bone will happens. So there is the rubbing between the two bone will happens. So that is the reason here the osteophytes will start to form because of the rubbing between the two bones. And whenever you will see the articular surface, this particular surface, that will be eburnation. It means after taking the bone out, whenever you will see, that will be the shining bone. Okay, shining border we will have. So why? Because there is continuously rubbing is there. So that will be, that looks like a shining border. That's what we call the eburnation. So here it happening due to the, here it is happening due to the rubbing of the two articular surface. Because of the age, there is the loss of the our articular cartilage, there is the loss of the synovial fluid and hyaluronic acid. And most importantly, you have to remember here, so this happens more rubbing in a more weightful patient, means in the obese patients. So you know, the more weight means more weight on the joint, more weight on the joint means more rubbing, means more risk of the inflammation of the joint. So by this process, the joint is getting inflammation. So we call this one as in the osteoarthritis, the most common type of the overall arthritis. We have the rheumatoid, we have the gouty, we have the osteoarthritis. Among these arthritis, the most common type of the arthritis we have is the osteoarthritis. So this will be high in the obese patients and old age patients. This happens due to the wearing, tearing and overuse of the joints. Especially this one will happen in the weight bearing joints. Okay, and you know, the patient is in a rest, so there is no rubbing. The pain will be relieved, means pain improves with the rest. Pain will getting relaxed when the patient will be taking rest. Okay, and when the patient is using the, or whenever patient is working, walking, that time there is the rubbing, that time pain will be there. So pain with the use of the joint and the rest, like pain reducing with the rest of the joint, will be a classical thing we will get in the osteoarthritis. Getting the point, brother? Yes, sir. And here the stiffness will be there. That is only for the duration of the less than 30 minutes. That is early in the morning. So that is the very important point you have to keep. And one more we have is the rheumatoid arthritis. So one more we have is the rheumatoid arthritis, where there is in the antigen antibody complex which is forming elsewhere in the body, especially after the like throat infection, and also those antigen antibody which is coming and which is damaging the our articular surface, articular cartilage, and where which is creating the inflammation at the articular cartilage, articular surface of the joint. So that is what you call the rheumatoid arthritis. So in that one there will be a history of the like infection of the our throat, and also but that is by the group A beta hemolytic streptococcus. So that means forms the antigen antibody. So that autobody antibodies are coming and destroying the our bone joints. So that is what you call the rheumatoid arthritis. So in the rheumatoid arthritis, stiffness will be there. So that stiffness will be more than 1 hour, not less than 1 hour. That is more than 1 hour of stiffness will be there in the rheumatoid arthritis. But in the osteoarthritis, stiffness will be only less than 30 minutes. And in the rheumatoid arthritis, the bone will be stiff. So when it will be stiff, so that time the pain will be there. Means whenever the patient is taking the rest, the pain will be there. And whenever patient will try to walk, the stiffness will be relieving. The stiffness will be relieving means pain is reducing. So in the rheumatoid arthritis, what will complaint will tell to us is, so whenever I am sitting, that time pain is there. Whenever I am walking, that with work the pain is getting relief. So that is the rheumatoid arthritis. Whenever I am walking, pain is increasing. That is the osteoarthritis. Whenever I am sitting, the relaxing, that time pain is increasing means that is the rheumatoid arthritis. So whenever I am taking rest, pain is reducing. That is the osteoarthritis. Whenever I am taking rest, that time pain is increasing. That is the rheumatoid arthritis. This is the basic point to be keep in our mind. Okay. So here what is there? There is the chronic knee pain is there. I told the osteoarthritis mainly damages the weight bearing joints. Okay. So the knee joint is the most commonly affected joint in the osteoarthritis. So please do remember. And this is worsening means the patient pain is worsening with activity. When the patient will work and he will do activity, that time there is rubbing is there, there is a pain is there. Okay. And improves with the rest. So when the patient will like take rest, that time improves means the pain is getting relieving. And morning stiffness only less than 30 minutes. Okay. And x-ray is showing that. So you can see here there is no any space between the joints. So similarly we will get in the x-ray also. So there is less space between the joint because the articular cartilage loss, synovial fluid loss, hyaluronic acid loss. So that is everything is lost between the joints. So there is no any space between the joints. Okay. So whenever we will take x-ray, there is less space or the narrowing the space between the joints. Okay. And here the osteophytes will be forming. So this osteophytes makes this bone to get bulge and enlarge. Okay. So because of this osteophyte, we will get the Hubbard's nodes, Bouchard's nodes. So that one I will teach. Okay. So please do keep this one in your mind, right? So here we have correct answer is the osteoarthritis. Okay. So if the in the given question the stiffness is more than 1 hour and pain is reducing with the work, so what may be your answer? That is the rheumatoid arthritis. Getting the point, beta? Yes, sir. So remember, here is the golden points revision about the osteoarthritis. The most common overall type of the arthritis is the osteoarthritis. I told we have the gouty, rheumatoid, osteo. So among these three, so which one is the overall most common type of the arthritis? That is the osteoarthritis is the overall most common type of the arthritis. Getting the point? So this is the degenerative joint disease also we can say, because there is in the degeneration is happening in the articular surface of the our joint. So that is the degenerative joint disease we also call. And this will be commonly seen in the elderly more than 50 years of the age, because these people have already excessively used the joint. There is more rubbing, more friction, because since from the 50 year they are using the joint with a heavy body weight, obesity. So that will causing the osteoarthritis, because the joints or the bones are rubbing together. Getting the point? Yes, sir. Next is caused by the wear and tear of the articular cartilage. So articular cartilage is the cartilage which is there at the surface of the bone, which is involving in the formation of the joint. So that cartilage is rubbed, and that is also get broken. So this, because of the continuous rubbing, there is in the eburnation of the joint. So what is the eburnation of the joint? Means there is a shiny bone borders we will get in the patient with the osteoarthritis. Okay. And remember, the knee is the most commonly involved or affected joint, because the knee is the major weight bearing joint. Okay, and pain is increases with the activity because the bone will get rubbed whenever we will do activity, and pain will be relieved by the rest because the bone will take rest. There is no rubbing between the bone in the osteoarthritis whenever we are in the rest. Morning stiffness is lasting more than only less than 30 minutes. X-ray is showing there is joint space is narrow and osteophytes are there. Okay, and usually there is no systemic symptoms like no fever, no weight loss, nothing. Management is reduce the weight from the joint. So reduce the body weight. Very important. So the goal of the treatment is reduce the body weight, because body weight is reducing, there is pressure from the joint is reducing, there is no rubbing between the joints. The relief from the osteoarthritis will get if the patient is ready to lose his body weight. Very important. Next, we will encourage the exercises where less involvement of the joint and which is focused over the reduction of the weight. Okay, and the analgesics we will give to control the pain. And here, most importantly, I told that the joints, there is the osteophytes will be formed. So what these cells will do? So these cells can lead to joint deformity and decreases the mobility. And here we will see, you can see here in the osteoarthritis, there is in the two types of the nodes we will get. One is the Hubbard's nodes, another one is the Bouchard's node. Better here you can see this is the my radius and ulna. Here we have a bones called as which bones? These are the carpals. Okay, so these are the what these bones? Metacarpals, and these are the phalanges. Okay, phalanges, metacarpals, carpals, radius, ulna. Okay, so here we have joint in the wrist, and between the our phalanges, this is the which kind of the joint? This one. This is the carpal phalangeal joints. Okay, or phalangocarpal joints we can say. And here we have between the phalanges. Sorry, this is the metacarpals and the carpals. This is the carpo-metacarpal joint we have here. Okay, and between the very important metacarpals and phalanges, which joint we have? Between the metacarpals and phalanges. So here, so this is the metacarpo-phalangeal joints we have. And here you can see 1, 2. Are you getting the joint here? There is a movement. Okay, yes. So this one, this particular joint where it is a first band. So this is very away from the body. I call this the distal interphalangeal joint. This is also phalangeal bone. This is also phalangeal bone. So this joint is the distal interphalangeal joint. Okay, and here this one near. This one is the proximal distal interphalangeal joint. Okay, distal interphalangeal joint, proximal interphalangeal joint, and this is the metacarpophalangeal joint. This one. These are the metacarpophalangeal joints. Okay, so getting the point, beta? Yes, sir. Now you consider in the proximal, this one, in the proximal interphalangeal joint, there is enlargement is there due to the accumulation of the osteophytes. So what I can call this one? So remember BP, that is the blood pressure. So proximal joint is involved and enlarged. That's the proximal interphalangeal joints. So remember that is the Bouchard's node. Bouchard's node. And you are watching my class in the HD mode, right? HD mode. That is the H in the stands. There is the Hubbard's node, and the which joint is involved here? The distal joint is involved. That is the HD. HD means Hubbard's node happens when the distal interphalangeal joint is involved. One more time, let me revise. One word changing the answer. Okay, so these are the our carpal bones, metacarpal bones, phalangeal bones. So this is the carpo-metacarpal joint, and this is the our metacarpal phalangeal. That is the metacarpophalangeal joints, and here we have the interphalangeal joints. So in the interphalangeal joints, this is the distal interphalangeal joint. This is the our proximal interphalangeal joints. In the proximal interphalangeal joints, there is the enlargement is happening. So that is what we call as the what we call that one as the Bouchard's node. That is the PB or the BP you can remember. Okay, and HD, that is the Hubbard's node. The distal interphalangeal joint is getting enlargement due to the accumulation of the osteophytes. So that is what we can call as a Hubbard's node. I hope it is very much clear to every one of you. And you may get the image based questions like this. Okay, so this is the proximal interphalangeal joint enlargement. that is the BP, that is the Bouchard's node we have. And here we have distal interphalangeal joints. So if this distal interphalangeal joints, if getting the enlargement, so that is the Hubbard's node. I hope it is very much clear to everyone of you, right? Yes, sir. So take a note. Hubbard's node is bony swelling at the distal interphalangeal joints. So remember, with the video you are watching in a HD mode, that's the Hubbard's node, distal interphalangeal joint is involved. And Bouchard's node, I know beta, you are feeling like you are understanding here. If you are not studying with the districts, no use of your study. You will get forget and you will get confused in your exam, and due to confusion you are making 1 marks negative, means that is no use of the study only. So studying the thing is not important. Studying the thing with the tricks, tips and application in the exam is important. Getting the point? Yes, sir. So that is the Bouchard's node we have here. So that Bouchard's node is the a bony swelling is happening with the proximal interphalangeal joints. That is what you call as the Bouchard's node. You can remember this one with the blood pressure. So this is very important. Bouchard's node, which is involving the proximal interphalangeal joints. Are you getting the point, beta? Yes, sir. So here I told the osteoarthritis is happening due to the loss of the what you can say, the synovial fluid, loss of the hyaluronic acid, loss of the articular surface and degeneration. So there is in the bony friction and the swelling is there. So we will give the intra-articular injection. What is the intra-articular, sir? So directly inside the joint only I will inject the drug. So which drug I will inject, sir? I will give the corticosteroids in the joint directly. So this corticosteroids will reduce the inflammation and pain. So the intra-articular steroid we can use in the treatment of the osteoarthritis. So for example, triamcinolone or the methylprednisolone I can use. Okay, so very important. Next we have, I told there is the chemical which is maintaining the viscosity and which is maintaining the lubrication at the joint, which is present inside the our fluid called as the synovial fluid. So that fluid, inside the fluid we have the chemical that is the hyaluronic acid. So that is the very important, which is responsible for the maintaining the what we can say lubrication, where I can inject the hyaluronic acid. So that is the viscoso supplementation directly into the joint. So that will forms the synthetic joint lubricant I can use, where the less friction will be there, okay, which will improve the joint lubrication and which will absorb the pressure and it will reduces the friction. So it may reduces the very important, what we can say, it is reducing the friction means what we can say, so that it will reduces the inflammation also, it will reduces the pain also. So this comes to the all the very important things what we have discussed in the today's class. That is the 2 hours complete fully filled session. So like these sessions will be going on in the A2 plan, A1 plan daily in the rapid revision session. If you are interested, you can join there and you will get the notes also there, and you will get the MCQs to solve on the question. Okay, so now you studied on the fracture, traction and the most importantly complications of the fracture, the fat embolism, compartment syndrome, and in this classical picture. Okay, so you studied about the like osteoarthritis, and you have got some idea about the rheumatoid arthritis, and you are getting the various points to be discussed. Okay, we discussed rickets, osteomalacia, osteoporosis, Paget's disease, many more things we have done in this today's class of the 2 hour session. So like this booster you are getting on a daily basis, 2 hour MCQ booster. So it will definitely push you, especially the clinical points and the important points that you must and should remember for the exam. So that one we are boosting in the daily regular class. If you are a part, if you want to become a part of that one, just purchase test series of the A2 that is the crash course. You will get this all video free only. Okay, and with the notes you will get in the YouTube also, that you will not get the notes and all. Okay, so for this class notes I will upload this one in the Telegram group. If you want to become a part of that one, so please do join our Telegram. You will get the notes also there. Okay, so thank you so much for watching this particular class till here, and don't forget to daily give the Super 60 test. So that is the game changer, where you will getting all the updated questions, clinical questions, concept based questions with the fully packed rationales and the updates. So that is going to be a rank decider in your upcoming exam. So thank you so much for watching the video till here, and if you found the video is helpful, and if you found something which is really boosting your energy, so please do comment something in the comment box. And if you have any doubts, so please do don't feel any hesitation to ask the doubt here everyone are watching this video to learn, and you are also watching this video to learn. So feel free to put your doubt in the comment box. We will try to respond to it. And thank you so much for completely engagedly watching this particular class till the end. We will meet again. So bye bye, take care. And here's the one very important assignment to you all. So please put the answer of this particular question in the comment box. The first question, so just how we have to mention the answer is mention the question number 1 and mention your answer directly in the comment box. The first question is bone forming cells are dash. The second question is question number 2, that is the bone destroying cells are what? Bone destroying cells are dash. And the third question you will be having here is, that is normal bone cells or the matured bone cells, what we can call. What is the name of the matured bone cells? So we will meet again with a very important MCQs on the other portion of the skeletal system, where entire skeletal system is covered in the 3 to 4 hour sessions. So that definitely it is going to help in your exam. So thank you so much for your response to this particular class. We'll meet again with the next very important class, same time tomorrow. Bye bye, take care.